And also on the rise, the number of people hospitalized here in the RGV. And a number of factors is threatening to accelerate the surge. Channel 5's Monica Deanda explains.
The reopening of schools, arrival of winter Texans, restaurants expanding capacity, and holidays like Halloween, Thanksgiving, and Christmas, all adding to an increase of COVID-19 cases in Hidalgo County.
And what happens? We go from 150 to about 200, to then the low 200s, and today we're approaching 300.
Hidalgo County Health Authority Dr. Ivan Melendez says Hidalgo County hospitals look busier today than they did just a week ago.
And a week ago, they were busier than a week before. And 2 weeks ago, they were busier than 3 weeks. So we see a steady increase.
Melendez says we're nowhere close to the situation we saw back in July and August, when there were 1,200 people hospitalized with COVID-19. But he says the increase in admissions still raises concern, a trend that's been going up and one Melendez expects will continue for the next few weeks due to family gatherings this holiday season.
A month ago, all the hospitals were down to 1 COVID unit. Now most of the hospitals are up to 1 to 2 COVID units. So are we going in the right direction? No. But are we in a safe spot? Yes.
Melendez believes the community could do more to help slow the spread of the virus. But he does credit those wearing a mask, practicing social distancing, and also treatments for the virus as factors that have helped keep hospitalizations lower.
We know now about the early use of steroids, big game changer. We know that remdesivir and plasma at an early stage are helpful. We know that monoclonal antibodies at an early stage are helpful. We know that delaying ventilation is helpful.
The survivability rate is also much better, and Melendez believes the COVID vaccine is a game changer. But for now, healthcare workers are prepared for a Christmas-related spike in COVID-19 cases. According to Melendez, hospitals are staffed appropriately with enough PPE, ventilators, and assistance from state and federal agencies.
Is that if we want COVID-19 to follow in the same path of smallpox, which has essentially been eradicated from the world, then we have to vaccinate the world. And that's 7 billion people. It's the longest voyage in the world, starts with the first step. And so I think that our community should take that first step.
Melendez says by the end of next year, it's estimated some 2 billion people will be vaccinated. Monica Deanda, Channel 5 News at 10.